You mentioned that you're from Vietnam and you shared some of the traditions that you have in your culture about what happens after a woman has a baby. And I appreciate learning about other cultures. And so thank you for sharing those things with me. In America, after a woman has a baby, which she typically delivers in the hospital, she'll stay for about 2 to 3 days, depending on her situation and the mode of delivery. And during this time, the doctors and nurses spend a lot of time teaching her how to care for herself and the baby. After she goes home from the hospital, her mother or mother-in-law usually come to her home and help her for a few days with the baby. During this time, while she's recovering, we actually encourage a woman to drink a lot of water because, for one, it helps with milk production. If the mother is dehydrated, that can affect how much milk she makes, and it also prevents constipation, which can be a problem after a mother has had a baby. If stool is more difficult to pass, then it's more painful, and that can lead to problems. So drinking water is a good idea. A woman's diet is not restricted after she's had the baby. After a vaginal delivery, she can eat whatever she wants. But if she's had a C-section, she does slowly have to work her way back to regular food because she had abdominal surgery. This usually only takes a day or two, so by the time she's left the hospital, she can eat whatever sounds good to her. As far as activity level goes, we encourage the woman to move around because the more a woman moves around after delivery, the faster she'll recover. A woman is at higher risk for blood clots after having a baby, and if she stays in bed all the time, then this risk goes way up. So walking around is really good. Exercise, like cardiovascular exercise, should be delayed though until 6 weeks after a vaginal delivery or 8 weeks after a C-section. In both instances, women are encouraged to not return to exercise until the doctor has told them that it's okay, because there are some things that might apply to one woman that don't apply to another that would make the advice the doctor gives slightly different. Housework can be started by her as soon as she's feeling good, and again, this might be part of getting up and moving around and establishing a new norm in your home. Bringing a new baby home requires a lot of adjusting, and getting back to a new routine, one that involves the care of your baby, can be emotionally helpful to a woman as she adjusts to her new life. As far as returning back to work, most women don't go back till at least 6 weeks postpartum, but some women take even longer if their company will let them take the time off. If you have any other questions for me in the future, please feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.